When someone has an ischemic stroke, what ends up happening is that there is a part of the brain that's not getting enough blood flow. There are parts of the brain that are silent, meaning that someone is having a stroke and they'll never know it. They might find out later on because we do some sort of a scan of their brain. Ischemic strokes, they can come from the heart, and we move from the heart all the way up into the brain. So in the heart, there could be a abnormal arrhythmia and atrial fibrillation, for instance. Some folks have that condition where the heart is not regularly beating, it's in an arrhythmic way. And what can happen is that blood flow has a irregularity and turbulence to it, and clot forms, and when the clot forms, it can get lodged into the brain, and that clot causes a lack of blood flow to that part of the brain, causing the damage to that part called ischemic stroke. Now let's move from the heart to the neck. Your neck has different blood vessels, one of them being the carotid artery, vertebral arteries on the back. The carotid arteries sometimes can get plaque buildup, cholesterol buildup, and when they get narrow enough, the blood flow doesn't have a really smooth way of getting through it. There's a lot of irregularity, there's a lot of turbulence. And when that happens, again, the blood can clump together and it can be sent into the brain, causing the blockage of the artery into the brain. Now we move up one step higher. Now there could be a problem in the brain blood vessels. In the brain blood vessels, you can have narrowing in the blood vessel. And when you have narrowing in the blood vessel, again, the same phenomena of clumping of the blood together, blockage of the artery, and not enough blood flow to the brain. If someone's having a stroke, their face could be involved. So you might see that your face is drooping. It could be that the arms are not working well. So most of the strokes are on one side of the body where there could be a drooping of the side. It could be heaviness, numbness, tingling. Now I want to say that there are strokes that involve both sides of the body, but that's a little bit less common. People can have a problem with speech production, meaning that they're trying to talk, but they're not able to get their words out. They're trying to understand, but they're not understanding other people. So that's called aphasia. That's a technical word for it. Your doctor might talk about that. So speech problems are the other things. The last thing that can happen is numbness, tingling of the hands. Those things also might happen. The treatment options for ischemic stroke have advanced quite a bit, even in the last 6 months to a year. The next step in evolution of stroke therapy was a clot-busting medication, and it's called TPA, tissue plasminogen activator. This is an FDA-approved medication. It's given through the intravenous route, and it's administered in the hospital. The success rate of this TPA, or tissue plasminogen activator, is pretty decent, but on the order of about anywhere between 20% and below. This is a good option for patients who are having a stroke to get to the hospital as soon as possible in order to hopefully qualify to get this medication. Not everyone can get it because there are criteria in terms of when did you arrive to the hospital, because we can't give it after a certain period of time. How big is the stroke already? But the point is, the sooner the patient gets to the hospital, the better. The newer technology that we have, or the newer methods that we have, are through an endovascular approach, where we actually gain access to the blood vessel through the femoral artery. Under X-ray technology, we go through and we are able to locate the area where the blockage is happening and try to extract or take out that blood clot from the blood vessel to reestablish the blood flow into the brain again. That method has been really shown to be the most effective. And that makes sense, is that if you reestablish blood flow to a part of the brain that's starving for blood, that has the highest chance of someone making the ultimate recovery. We offer that 24/7. We have a whole dedicated team who is on call at all times, so we were able to serve those patients.